5 health checkups you should think twice about after 70 because they might harm you more than help. That sounds intense, I know. But there's an uncomfortable truth many older adults never hear clearly. Every year, millions of seniors get routine tests believing they're staying safe. And yes, medicine saves lives. But there are also tests that at certain ages and in certain situations can open a dangerous door. The door to fear, doubt, more tests, unnecessary procedures, and sometimes complications that change your life. Here sits the hardest part. Some studies suggest that a significant share of medical testing in older adults ends up leading to unnecessary treatments, side effects, or rushed decisions. In some analyses, numbers close to 37% are mentioned for tests that trigger interventions without a real benefit. And the saddest part is that most people over 70 don't even know this is happening because we trust, because it sounds logical. Because if a doctor orders it, refusing can feel irresponsible. But protecting your health also means knowing what to ask. It also means knowing when to pause. It also means knowing how to choose. Today we're going to cover 5 checkups that after 70 are often better to avoid, or at least to discuss very carefully before you agree to them. Not to live in fear, but to live with more control, more calm, more clarity. One important note before we begin, this video is educational and does not replace medical advice. The goal is to give you tools to have a better conversation with your doctor, ask for alternatives, and make informed decisions based on your history and symptoms. Now let's begin. Before we start, tell us in the comments what country you're watching from, your age, and one respectful question. Have you ever had a test or procedure and later felt it wasn't worth it or that it left you worse off? Also, tell us if you believe seniors are tested too much. We read and reply to comments, and many future topics come from what you share. And if this helps you, please like the video and subscribe, because here we talk about senior health without drama, but with the truth on the table. Let's start with number 5. Bone density scanning, the classic bone density test. At first glance, it seems harmless. It sits quick, no pain, no needles. You walk out with a number that supposedly tells you whether your bones are good or bad. And here sits what almost nobody explains. After 70, it's very common for that test to come back low, even when there's no real immediate danger. Because bone density naturally declines with age, just like gray hair, just like wrinkles. That does not automatically mean you're about to fracture a bone. But when the result looks scary, many people get pushed into an automatic pathway. Medications to strengthen bones, such as certain bisphosphonates. And in some people, those medications can cause serious side effects. Irritation of the esophagus, severe reflux, significant pain, digestive problems, and in rare cases, a serious jaw condition where the bone begins to deteriorate. The big issue is that for mild bone loss in adults over 70, the real benefit can be small. In some follow-ups, fracture risk reduction from medication in certain groups is minimal. Meanwhile, the body still pays the price of side effects. Let me share a story similar to what happens every day. Rose, 76 years old, retired, walked daily, and had never fallen. She had the scan and it showed osteopenia, which is mild thinning, not osteoporosis, but the fear hit immediately. She was prescribed medication. Within a few months, severe reflux and jaw pain started. She stopped eating well and she grew weaker. When the approach changed, everything changed. Vitamin D if deficiency was actually confirmed. Gentle strength training with resistance bands, balance work, more protein, more calcium from real food like sardines, seeds, and leafy greens. A year later, Rose felt steadier, stronger, and had 0 fractures. The point is not never do this test. The point is, if you feel well, if you are not falling often, if you have no fracture history and no high-risk signs, the most powerful approach may not be a scan. It may be lifestyle, strength, balance, sunlight, nutrition. Now number 4, brain MRI for mild forgetfulness. This one hits emotionally because fear of dementia is real. The senior feels a little more distracted, misplaces keys, forgets a name, and panic shows up fast. So the automatic response is often a brain MRI. Here sits the uncomfortable truth. In people over 70, an MRI often shows age-related changes. Small shrinkage, white matter spots. Details that sound alarming when read without context, but can be normal. The problem is not the image. The problem is what happens afterward. Anxiety, more testing, appointments where each specialist sees only their piece, and sometimes invasive procedures that do not improve memory. They can even worsen overall health through stress, sedation, or complications. Picture this. George, 74, active, only noticed he sometimes took longer to recall names. He had the MRI. The report mentioned mild vascular changes. George translated that into something is wrong with my brain. He stopped driving. He stopped going out. He isolated himself. His memory got worse, not because of disease, but because of anxiety. When he later took a simple paper-based cognitive screening, he tested within normal range. What he needed wasn't a machine. He needed structure, better sleep, hydration, medication review for drugs that cause drowsiness or confusion, movement, social contact, brain stimulation through real life, conversation, reading, simple games, music. The key idea is this: if there are strong warning signs, seizures, sudden personality changes, rapid functional decline, then imaging can be appropriate. But with mild forgetfulness, the smarter first step is often a basic cognitive screen and a review of habits and medications. Simpler, cheaper, less fear. Now number 3, cardiac stress testing. The treadmill test, or the one where medication simulates exercise. It sits common. Too common? Sometimes a senior says, I get a bit tired on hills, or I done it that have the energy I used to. And a stress test gets ordered almost by reflex. The problem is that after 70, these tests can produce false positives more often, meaning the test suggests a problem that is not actually there. In some reports, false positive rates can approach 40% in certain older populations. And when the test looks abnormal, a cascade begins. More tests, angiograms, catheterizations, stents, surgeries, not always because they're necessary, but because the system pushes action when it sees a shadow, and those procedures carry real risk. Bleeding, infection, kidney injury from contrast dye, arrhythmias, long hospital stays. Let me tell you about Raymond, 75, who walked daily. He mentioned mild fatigue on inclines. Stress test, unclear results. He was sent for catheterization. They found mild narrowing and placed a stent. That night, he reacted to the contrast dye and developed kidney problems. 6 days in the hospital, weeks of recovery, and the fatigue stayed the same because it wasn't the heart. It was hydration, rest, mild anemia, and weaker legs, things that improve with training. So what sets the more sensible approach? If you don't have clear classic symptoms, chest pain with activity, major shortness of breath with light tasks, fainting, or a sudden steep drop in function, a stress test may not be the first step. Sometimes a resting ECG is enough, sometimes blood pressure control, sometimes checking thyroid, iron, sleep, breathing. And if risk evaluation is needed, there are more targeted options that are less likely to push you toward procedures from a false alarm. Now, number 2. Routine colonoscopy after 75. This surprises people because for years we were taught colonoscopy is always best, but it's not that simple. At advanced ages, procedure risk increases. The bowel prep with strong laxatives can cause dehydration, dizziness, blood pressure drops, kidney issues. Sedation can affect an older brain more strongly. And the procedure itself, while often safe, can cause bleeding or perforation in some cases. And here sits the key. In some large studies in older populations, the life-saving benefit of routine colonoscopy beyond a certain age becomes small compared to the number of serious complications. In simple terms, for many adults over 75, the cost of the test can be higher than what it truly delivers. Also, many polyps grow slowly. And here sits a tough but necessary reflection. Not everything that is found must be removed. Not everything that is seen must be operated on, especially when recovery is harder with age. Let me share Diana Sipp's story. Diana, 73, had no symptoms, no blood, no major changes, no strong family history, but she was pushed into it just because they removed a small polyp. That night, severe pain. She fainted. A bowel perforation was diagnosed, 9 days recovering. She lost weight, lost strength, and took months to feel normal again. Later, reviewing her history, she had already had clean colonoscopies before. It wasn't needed. What alternatives exist for many older adults? At-home stool tests, such as fecal immunochemical tests that require no sedation. No harsh prep, and still flag concerning signals. So if positive, a targeted colonoscopy makes sense. In other words, you don't enter the pipeline without a reason. You filter first, then act with precision. And now number 1, the most overmarketed, flashy, and potentially harmful checkup when done without symptoms. Annual full-body CT scanning, the whole body scan for prevention. It gets sold as luxury technology, as the smart move to catch cancer early. But here is the frightening truth. A CT scan exposes the body to ionizing radiation, and a full-body CT is a high dose. In some ranges, it can be comparable to hundreds of chest X-rays depending on the protocol. And here sits the worst part. When you scan the whole body without a clear reason, you almost always find something. A tiny nodule, a cyst, a calcification. Findings that are often harmless parts of aging. But the moment it shows up on a report, alarms go off, and the chain begins. More scans, more contrast, more specialists, biopsies, surgeries, and a massive amount of fear. Some recent models have warned that the widespread rise in CT imaging could contribute to a portion of cancers attributed to medical radiation exposure. In some analyses, a figure close to 5% of all cancers is discussed. Think about what that idea means. 1 out of 20. Triggered not by the original disease, but by accumulated exposure from a test that was supposed to prevent illness. This is not an accusation. It's a call for caution. Let me tell you about Marcus. Marcus, 80 years old, active, felt great. He bought a private, elite checkup package. Full body CT. They found a tiny nodule. He was referred to oncology, then a more advanced scan, then a biopsy. The result was benign, but the biopsy collapsed part of his lung. Hospitalization, 2 months of recovery, all for something that most likely could have been left alone. That is why many experts are clear. Full-body CT scanning is not recommended as routine screening for adults without symptoms. If there are warning signs, unexplained weight loss, coughing up blood, a visible lump, persistent unusual pain, then yes, targeted imaging. With a purpose, with a clear clinical question, not random scanning. Because looking for something without context is like opening doors without knowing what's behind them. You might find something, but the cost could be worse than the finding. So what do we do with all this? Do we avoid all checkups? No. We choose better checkups, smarter checkups, with one simple principle. Before any test, ask this. What are we suspecting? What changes if it's positive? What changes if it turns negative? What are the risks? What happens next? And if what happens next is a chain of procedures and your real risk is low, the healthiest choice may be to pause. Health after 70 is not only about detecting things. It's about living well, moving without fear, sleeping better, eating real food, keeping strength in your legs, preventing falls, managing blood pressure, having a primary doctor who knows you, not just a system that orders tests. Because the best prevention often isn't inside a machine. It's just in the basics. Walking, gentle strength training, enough protein, vitamin D if needed, hydration, reviewing medications that cause dizziness or confusion, staying socially connected, having purpose. And yes, doing tests when they are truly indicated, not from routine, not from pressure, not from fear. Now I want to hear from you. In the comments, tell me if a test ever led you into an unnecessary scare. Or if you know someone who had a complication that could have been avoided, your story could help someone else. And if you want, in the next video, I can share a practical checklist of exact questions to ask your doctor before agreeing to any test so you don't get pulled into a chain you don't need. Thanks for watching to the end. Protect your health with calm, clarity, and courage. See you in the next one.